Now this is my second inning of my life after retirement, and I will try to continue my professional services hereafter also. Let us hope that I will not retire early. With your kind support, I am sure that our professional standard we have to increase through our technical know-how. Since morning we have started, I think at 9 o'clock. I took comfortable rest at my relatives' residence, and then I have joined you at 3 o'clock. After 6 hours, you have to be with me for another 1.5 hours, and we are going to discuss about large animal practices, resolving large animal gynecoclinical cases. Now, I do not know how many of you are really in touch with large animal practices, but definitely those who are working in outskirts of Bombay, definitely they are visiting many farms, and you must be involved in the large animal practice. Friends, first Sunday of August is a Friendship Day, and I extend my best wishes of Friendship Day to you all. Thank you. So let us start with the first and the foremost thing. We generally neglect growth as a factor which is related with the reproduction. And this growth is very important not only during the pubertal life, but also it is important during postpartum period also. Because animal has to grow, and then only animal will come to the cyclicity after parturition. Second important thing is that in case of large animal reproduction, regular monitoring is required, and this monitoring is monthly required. For all animals, monthly gynecoclinical examination is a must if we have to get maximum returns from the animal. If we consider the productivity and economics of the animals, generally dairy animals and dairy farmers, they do not understand the importance of, number one, early puberty, number two, regular parturitions with 1 year interval for cows and 14 months interval for buffaloes. And the last thing, which is not at all acceptable in India, that is number of lifetime calvings from a cow. Number of lifetime calvings, most important factor, because after 5 or 6 calvings, generally buffaloes are put to the slaughter, and therefore this particular dairy business is not at all profitable with 5 or 6 type of calvings in the lifetime. The last part is very important, Jogan. Do we know who is Jogan? We have mobiles, please search for Jogan, and you will find that a crossbred cow from a Haryana owner yielding 76 liters of milk per day in India. If we consider Reshma, a Neeli Ravi buffalo, 36 liters per day with fat percentage 11.5. These are the Indian records. And if you search for world records, you will be surprised to know that cows, they are producing nearly 125 liters of milk per day. Buffaloes, they are yielding little more than this 36 liters per day. These type of records are not the records which are to the credit of the buffaloes or to the cows, but these are to the records or to the credits of animal owners. The way in which they are maintaining their animals, that is most important thing, and therefore we should recognize this large animal reproduction in a better manner. First important thing is that in case of males, it is a continuous type of reproduction, whereas in females, it occurs cyclic and phasic manner. This reproduction is always a vagabond type of activity in the body. You don't expect anything regularity in this particular system. It is only because organs are different in males and animals. Animals are reproductive activity is controlled by the hormones. Third important thing is that all other bodily systems, they should work normally, then only this particular system will start. And important thing is that this is the only system which starts working at the time of puberty. And therefore, such a type of differentiation is most important thing. And therefore, a veterinarian has to take a control on this type of, next, right. These are the measures of fertility in case of animal. Preliminary things I will come, I will elaborate, and then we will go to the directly to the gynecoclinical type of cases. So by these type of factors, we assess the reproductive performance of the animals. And friends, 30% of available animals in India are becoming pregnant every year. And 70% is a challenge for you and me. You go in any state, this is the situation. 70% animals, they do not become pregnant in a year. Only 30% animals, they become pregnant. And therefore, our milk yield is less, our animal productivity is less, and we are not getting the results out of it. This part is very important. We should know about the control of reproduction. And this control of reproduction is because of this steroid, estrogen, progesterone. Estrogen and progesterone is the one thing. It is Ardhanari Nateshwar thing. The same hormone becomes up during diester stage. The same hormone is converted to estrogen and it becomes up during estrus. And this is the cyclicity. Consider about the pedal. Animals with slow type of cycling, low level of progesterone, low level of estrogen, low level of progesterone, low level of estrogen. Forget about fertility in these type of animals. Strong progesterone level, strong, lowest level of estrogen, highest level of estrogen on the day of the estrus, lowest level of estrogen during diestrus. This type of animals are only fertile animals, they are cyclic animals and they are getting a result. And therefore, we should consider about this type of cycle. Whatever the treatments we are adopting in case of large animal practice, those must satisfy this type of cyclicity in case of large animals. Levels should increase from day 3rd onwards up to day 7th. Level of the progesterone should be maintained up to 14th day or 15th day, strong level. And thereafter it should come down and then estrogen level should increase. So if this type of changes they are taking place, then only the animals are fertile one. Otherwise, low level of progesterone will not stimulate for higher level of estrogen during the estrus, and we may not recognize whether the animal is in estrus or not. Something secret going on regularly, but these are silent type of animals and we will not recognize the exact time for the breeding. Next. Yes, this is the chart where I have added FSH and LH. This part is very important. FSH has a specific role on day -1. LH has specific role on day 1, and that day 1 is late day 1. On the day 1 or 0 of the estrus cycle, estrogen level is high, but as estrus stage it proceeds, it comes to end, LH will create the changes. LH has major important role in animal reproduction. Both these hormones, FSH and LH, we can have through GnRH, and that we are going to discuss. Last part is about the prostaglandins. On 15th day onwards, prostaglandins are expected from the uterus. Healthy endometrium will only secrete prostaglandins. And if prostaglandins are there, vasoconstriction will lead to constriction of the corpus luteum, and then animal will come into the estrus. Progesterone level will automatically go down. This type of criteria is necessary in case of normal cyclicity. And whatever the treatments we are adopting, we should adopt the treatments in this particular chart or through only like this chart. Otherwise, if we are giving progesterone on the day of the estrus, ठंडा करने का इंजेक्शन throughout the UP, this is the terminology, ठंडा करने का इंजेक्शन, डॉक्टर भी ठंडा, जानवर भी ठंडा, एनिमल भी ठंडा और सब ठंडे, कुछ फर्टिलिटी नहीं होगी. Progesterone is expected only after 5th day, 6th day, 7th day. We use only after 8th day. 8th day, 10th day, 12th day, you can use ample progesterone up to 13th, 14th day, that's all. On the day of the estrus, what we have to use, on the day of, say, post-estrus, what we have to use, that we should think in a proper manner. Next, GnRH. Use amply. Whatever amount you want, you use it. In case of gynecology and large animal practice, if you are using 5 ml instead of 2.5 ml, you are not wrong. but reduce the dose. Why to use unnecessarily extra dose? 2.5 ml is more than sufficient. This is to be used on the day of the stress. When animal is in standing heat, use it. Advantages are two types of advantage. Number one, it will lead to prompt ovulation. It will lead to ovulation. Definitely it will lead to ovulation. And this ovulation is through its LH effect. Through LH effect. Number two, it will add to estrual signs. We have nothing to do with estrual signs. Please remember that all veterinarians have nothing to do with estrual signs of the animals. There are 30 different estrual signs in case of the animals. In case of crossbred cows, we generally observe or we list out such a type of observations. Discharge, bellowing, moving toward the fencing, and so many things. Not a single clinical sign of the estrus is favorable or it is to help for a veterinarian. Never depend upon these type of signs. Our rectal examination is most important. If we have to confirm the stress, three things are important. Number one, open cervix. Let there be no discharge. But if the cervical position is open, if there is a tonicity of the uterus, both the uterus, and if there is follicle on one of the ovaries, the case is fit for insemination. This case is fit irrespective of discharge. But in case of field practice, ample discharge is going on in all animals regularly throughout the months, and we are free to inseminate all animals regularly without considering the status of that particular animal. And therefore, this particular point is very important, that if we go for GnRH, it will lead to prompt ovulation, it will add for signs of the stress. The third important thing is that it provides LH, and through LH, it will boost development of the corpus luteum. Next. Right, next. FSH and LH. There is limited use for FSH. Please remember, there is limited use for FSH. LH you can use. But instead of LH, if we go for a GnRH, that is more appropriate and better. LH is a protein hormone. If we use proteins regularly, it will form antibodies against this type of protein, and therefore cystic type of ovaries and all those things are possible. LH is costly. LH has only one type of benefit, that it will go for ovulation and it will add for the ovulatory type of the process. But if we go for GnRH, this GnRH will secrete or it will stimulate endogenous LH. This is exogenous LH. This is protein type. Endogenous LH is more important because it has more biological activity and it will have more prompt type of the effect. Next one. Estrogens. Entire cyclicity or particularly the stage of the estrus is controlled by the estrogens. Muscularity, vascularity, tonicity and glandularity, these are the three things which are very pathognomonic and which are very characteristic for the estrus. Whatever the changes we are observing, it is only because of the estrogens. And using estrogen is rarely required in the practice for estrus. For estrus, during estrus, rarely it is required. Next. Progesterone. Yes, progesterone you can use it very safely from day 5th onwards of the cycle. As CL develops, definitely use progesterone to make the CL more and more strong. 5th day, 7th day, 9th day, 7th day, 9th day, 11th day, 9th day, 11th day, 13th day, use progesterone. 250 milligrams will be more than sufficient. We are regularly using progesterone also in case of the animals. But this is required only after 5th or the 6th day, not before that. Not before that. Unless CL is made strong and unless natural CL is of grade 3 type, size grade 3, grade 1, grade 2 and grade 3. Always try to palpate the type of the CL. If it is a small gram nut size, this will secrete less amount of this progesterone. Structural, because we are clinicians. If it is better one, if it is just like a matar one, definitely it will secrete intermediate type of the progesterone, level of the progesterone. And if it is a very huge type of one, definitely Kabuli chana, it is a Cl, and that Cl will produce the progesterone which is required for optimization of endometrium. So for that purpose, we can use progesterone from 5th day onwards. Next, prostaglandins, use it carefully. Whenever you are interested to evacuate the uterus, use it. Whenever you are interested to disrupt the cycle, cut short the cycle, use it. But unless and until you palpate the Cl, never use progesterone. Every time you have a chance to use the prostaglandin, only when Cl is available on the surface of the ovary. Otherwise, it is a futile type of job. Many veterinarians, they use prostaglandins even on the day of the estrus. The paravets, they have license to use all type of hormone on all days. And therefore, if we go with this, definitely it will create a havoc. So prostaglandins is a luteolytic dose. 2 ml wet mat, prosolvin, anything you can use it, and you can go for cut short of the cycle. In case of repeat births, you can do this type of practice. Next one. Next, estrogen, progesterone. The same thing I was telling you, that this particular type of activity must be strong enough to help each other, because it is Ardhanarinaeshwar, the same hormone. Only level should be high. If cycle is going like this, the speed will be less and covering of the distance may not be possible. Reproductive distance may not be possible. If it is like this, definitely this will help. Strong estrogen level is necessary for detection of the stress for animal owners, and strong progesterone level is necessary for fertility. High level of progesterone, high level of proteins, and high level of vitamin A. This is the relationship. This is related with the fertility. Higher progesterone, higher vitamin A, higher fertility, higher energy. These are combined each other, and these are the friends of each other. The next one. This is very important. Balancing of ration. Whatever milk we are expecting, we should provide the nutrition to the animals. NDDB has given a ration balancing formula. Not 0.1% of the veterinarians nor the 0.1% of the farmer breeder, they are using this. This is available. Ration balancing protocol is available from NDDB. If we go on using this type of formulation, 50% infertility problems will be resolved. 50% problems will be resolved. Next, what is important is the energy. This energy is always required for the growth, for lactation, for stress induction, and so many things. In my 35 years of service, energy provided through good which is of quality 2 type, which is produced before 2 or 3 years, which is most black in color, and which is cheapest one, gives best results. Don't use organic type of the good. Whatever is available in the market as a stock, long time stored type of good sample, that will suffice the purpose. Energy level is directly related with the blood glucose. If you test the blood glucose in case of buffaloes, you will be surprised that with such a type of 35-40 level of glucose in the blood, how buffalo is going to exhibit the signs of the stress. The same buffalo you feed with 100 grams of the good daily, and you will find that buffalo will also show the signs of the stress just like cow. We are regularly blaming the buffaloes, silent breeder, night breeder. It is not like that. Buffaloes can exhibit the best stress more comfortably than cows. But where is the energy for them? Whatever short we are feeding, we are expecting much. We are expecting 10 times more from the buffaloes, and therefore this energy part is important. Next one is the proteins. Protein is related with the phosphorus, and that is related with the estrus. Protein, phosphorus, and then the ovulation, these type of follicular development, there is a relationship. And therefore our soils, please remember that in Maharashtra, the soils are less in phosphorus. So whatever the phosphorus preparations you have to use, you use it for induction of the estrus or during the estrual phase. For parturition, go for calcium. So if we go for phosphorus type of therapy, definitely it will help for induction of the estrus, and also it will smoothen the total reproductive activities of the estrus. Next, excess of the proteins are not required. Please remember, excess of the proteins are not. If proteins are excess in number or unnecessarily we are feeding only cake to the buffaloes, these buffaloes, they will not settle. That we know. Fatty acids. Checking and controlling these things is very, very important. Fatty acids. And bypass fats regularly we are using through soybean, that is very important. So instead of direct using fat, which is very costly also, if we use for soybean, definitely it will give the result. 10% soybean in daily feeds, it will provide protein and fat, and that will also suffice the purpose of bypass protein. Next one. Calcium, more important for parturition, we will discuss afterwards. I will hurriedly go through these type of nutrients. Plus, phosphorus for estrus induction and for the ovulatory type of the events. Next one. The magnesium is also important for integrity of the teeth, bones. We know this, they are holistic. Next, sulfur for protein synthesis and also for cellular respiration. Next, zinc, manganese. So micro minerals and macro minerals total combination must be fed daily to the animal. Then only our nutritional strategy management can be optimized. Next one. Iodine is more important in case of the reproduction than iron and the cobalt. Yes, hematinic mixtures are more important, and this part is little more important. Those who are from nutrition department, they may be knowing that it is not the actual level of the nutrition, but it is the interaction of the nutrient that is more important as far as the reproduction is considered. Next one. So vitamins are more important, vitamin E and vitamin A that we are regularly using in clinical practice. Next. Of course, water, back. Yes. Ample water, clean, odorless, soft, fresh, questionable type of thing in case of the dairy farms. Whatever water is available, amply it is available for washing of the animals. Those who are washing the animals, they are washing their dairy business. They are washing in no book of veterinary science, cleaning of the animal with ample water is written. If at all it is there, you show it to me. Use such a type of water which is only required, optimum type of requirement is there, and if you want to wash animals, go for it. But unless and until you dry it, you have no right to use washing of the animals. In case of buffaloes, in case of cows, otherwise, the same water is a killer for that particular farm. We are going to discuss. Next one. Ration balancing program, I will re-emphasize. Next. Now this is the infertility. No animal is normal and infertile. This is the sentence from my professor, Dr. Pargaonkar. No animal is normal, and if it is normal, then it should be fertile. If it is fertile, it should never it is a normal type of animal. We have to pinpoint what type of factors are available for which are responsible for infertility. Huge number of dairy animals are there, and they are facing this type of infertility problems. Buffaloes are unnecessarily put to the slaughter only because they are infertile. And the problem is related with the management, problem is related with the nutrition, problem is related with the record keeping. This is a very important thing. Next one. Infertility and particularly the anestrus. Next one. Hereditary origin. Whenever we are observing the heifers, please confirm normalcy of the genitalia, cervix, both the horns and the ovaries. Many field veterinarians, generally they ask owner that yes, this is underdeveloped type of genitalia and animal will take another 3-4 months for induction of the estrus. It is not like that. If it is a 250 kg body weight, animal has to come into estrus. If a heifer, cow heifer is there, and if it is 250 kg in body weight, animal has to come into the body. This particular part from 225 kg onwards up to 260 kg, no treatment is required for a heifer to come into the stress. There is a requirement of one measuring tape. And this particular tape is always available with the tailor. Body weight measurement with a tailor's tape can predict about the induction of the stress or expected stress in this particular animal. 238, 240, 242, 244, yes, definitely animal is coming or is expected to come into the stress. 246, 244, 242, 240, animal is going down. No chance of animal coming into the stress. So for that purpose, controlling the growth is very, very important, and this type of controlling the growth is at the hands of the owners only. Number 2, body score condition. One can observe the body score. You can observe my body score condition. It is more than compatible. Others are lean and thin. It is not that they are not dynamic or active enough. But if the body condition score is good enough, definitely animal is going to come into the stress. Record normalcy of the each reproductive tract, and particularly that of the ovaries, because ovaries are the functional units, reproductive functional units. Must be active, must be some type of smoothness must be there on the ovaries. That will definitely indicate that yes, there is a possibility of expected stress. Next one. Functional infertility is related with the true anestrus. Before puberty, animal is in true anestrus phase. After postpartum for 2 months, animal is in true anestrus phase because ovaries are not expected to work at all. Substress or the silent stress, where the cyclicity is going on in case of the buffaloes, and we regularly observe either CL or the GF. Only veterinarians can diagnose this particular condition regarding the cyclicity. Persistency of the CL. If there is only CL, it is our duty to check whether this CL is persisting. An animal is not reported into the stress after 21 days, but when we observed there was CL. This animal needs to be examined, re-examined after 10 days. 3 examinations for CL, and if the same size of the CL is observed on the surface of the ovary, this is the case of persistent type of the CL. Poor conception rate is a national problem. We are not able to improve this up to 60% as ideal. There are many reasons, and the reasons are so bad that it is possible to increase this type of conception rate, but there is no stimulus for improvement of conception rate in case of the animals. 3 years back, before Corona, we have prepared a booklet, Krutrim Ratan Pustika. This particular booklet is not available on government website. We have spent lakh rupees. 15 persons were there. We sat together for a week. We prepared it point-wise manner for LSS people. It is not available still on website. I will be requesting our president just to circulate this type of booklet. It's only a 40 pages booklet having many slogans and having many type of the tips. So if we are using it, definitely the conception rate can be increased, can be improved. One insemination, one conception must be the motto of a veterinarian. Then only I will call myself as a veterinarian. If I am requiring 2 services, if I am requiring 3 insemination, I am not a veterinarian. I will not inseminate a case which is not fit for insemination. If we avoid such a type of cases, definitely conception rate will increase. But if we regularly inseminate without considering the status of the animal, definitely we have an ample chance to grow ourselves. But animal conception rate will be down and down. The next one is the cyclic non-breeding, repeat breeding. Definitely we will discuss in detail about this. Post-service anestrus is seen in case of buffaloes. Please remember, this is in case of buffaloes. Buffaloes are served, and thereafter there is no stress at all. Thereafter there is no pregnancy also. So post-service anestrus, that is the condition in case of buffaloes, and therefore monitoring. And I told that monthly monitoring is required in case of buffalo. For that purpose, early embryonic mortality can be controlled to some extent with our treatment approach. Next one. Environmental stressors are there. Extremes of environment you are observing in Konkan. Lactational stress is also there. Whenever there is a stress, animal will not show the signs of the stress, or animal will stop the cyclicity. And ill health. Of the ill health, anemia is the first best friend of stress, and therefore to subside or to treat the cases of anemia, hematinics and the best therapy. Simple therapy is just check the animal for fecal sample. Diagnosis of this type of fecal sample will suffice the purpose. 10% samples from a farm are more than sufficient to get the idea of that particular farm. It is not necessary to go for all. And for anemic conditions, very simple type of treatments we know and we can adopt in case of the animals. Next one. You are using it. It's a stimulatory type of approach. A bike will start only after giving a kick. Nowadays the electrical bikes are available and we can start it without a kick. But if we give a kick with this type of stimulatory approach, animals, they will come to cyclicity. So this cyclicity needs kick. The best kick is available through our parectal massage. This is the best kick. Those animals which are not showing the signs of the stress, or those are really having soft type of ovaries, some follicular fluid, and if we are palpating them, this type of stimulatory approach will also lead to stress in case of 10 to 15% animals. Comes into stress or not at a proper stage after voluntary waiting period. After waiting for 60 days in case of cows after parturition, and in case of buffaloes 90 days after parturition. Why not to go for preventive type of approach? Go for stimulatory approach. Start feeding good 100 grams daily. Within 10 days, 50% animals will be in stress. No need of any type of treatment, hormones and like that. Next one. Right. Use ample progesterone in case of stress. If a farm is having 10% unstressed type of animals, please remember, if a farm is having 10% unstressed animal, this farm needs to be checked for nutritional audit. Nutritional audit of the farm is necessary if 10% animals are not coming into the stress and if they are unstressed. So this nutritional audit, whether we are regularly going, attempting it or not, that is necessary. What owner is feeding, that needs to be investigated. Otherwise, this particular problem will not resolve with our treatment. The second important thing is that progesterone is available as an injection. 60 to 70% results we are getting with progesterone. You can use progesterone with GnRH. Use progesterone on day 1st and day 10th you go for GnRH. The GnRH will give best type of the result on day 10th. Animal will be in stress on 11th or the 12th day. This 60-70% will be increased to 80%. 80% animal will show the signs of the stress. Progesterone with PG. If a CL is observed on the ovary, definitely you can use prostaglandins on 7th or the 8th day of the progesterone treatment, and that will also lead to the induction of the stress. Estrogen progesterone combination, norgestromet treatment, it is available in the form of implants. Really these are costly type of the things and these are not required on a regular way or regular practice. But if we want to monitor and if we want to have a control type of breeding, use it. If an owner is interested to spend 1,500 rupees, definitely he can use sponges, he can use freed, or he can use the norgestromet implants also. Control 95% animals will come into these stress, and it is possible to make the animals, other animals, these animals pregnant. Next one. Those animals which we are interested to make them pregnant with 100% type of the result, this is the best friend. Very simple. A field veterinarian, I will quote his name, intentionally I will quote his name, Dr. C.G. Giri is from Amravati. He has used 100 such a type of protocols in case of Goshala animals. And regularly he is providing the proof, yes, I use this particular protocol and it is giving me the results. So this type of protocol is very simple, 700 to 800 rupees, it's a treatment cost. assurance is 90%. Assurance is 90%. And this GnRH makes a havoc. Because this ensures everything about ovulation, then formation of Cl, and then even normalcy of endometrium, and also the conception. So this type of approach, you can have GnRH, you can either change by 12 hours earlier, 12 hours late, inseminations you can adjust, and it is as per your convenience. You can change the GnRH, second GnRH and AI schedule. That will give us the better type of the result. Next one. GnRH has the best type of result only because I told that it brings about, number one, if there is a dominant follicle on the surface of the ovary, that will be ovulated immediately after giving first dose. If there is no type of follicle, it will start folliculogenesis. Number one. Number two, after 7 days, whatever the follicle is developed, that will become a Cl, and that can be regressed with the PG on day 7th. And the second GnRH will be helpful for second wave of follicular growth, and that will give us the results. So this is the best type of the treatment. Next one. Benefits. This is only a theoretical type of the thing. Next one. These are the other type of protocols. Nowadays, there are minimum 100 protocols available in the market, 100 protocols. Those who are interested, they can just read out the literature about the controlled breeding protocols, and you will get such a type of protocols in case of the animals. Use it amply in case of the animals. These are more safe type of protocols because initially they are providing GnRH, they are maintaining GnRH in case of the animals, and then they go for prostaglandins. So absolutely no problem as far as these protocols are considered. Next one. Next one. Right, these are the type of the protocols with which we can go ahead for induction of the stress. Next one, repeat bedding. Should I continue with the repeat bedding, or you want some break? This what I said earlier about the reproductive efficiency is that in case of cows, we expect parturition before 28 months in case of cows. We expect it less than 34 months in case of buffaloes, and these type of norms we should follow in case of the animals. This is a normal expected type of thing in case of the animals. Next one. This is most important. Repeat breeding and conception rate, these are the two important type of the things which are correlated with each other. In a group of 100 animals, with the first 100 inseminated animals, it is expected that at least 45% animals must become pregnant. With the second AI, of the remaining 55 animals, 50% animals should become pregnant. So this will be something like 45 plus 27, 28 like that. In the third artificial insemination, 50% of those remaining, means up to 25, 26, 13 animals. In all, 85 to 95% animals must become pregnant with the 3 insemination, maximum 3 insemination. This is all ideal and expected. This is all ideal and expected. So next one. In case of conception rate, it is important to note that a pregnancy in case of large animal is dependent upon 4 factors. Cow which is in estrus, bull semen which we are using, inseminator who is inseminating that particular animal, and the fourth important thing is that what type of procedure we are adopting, or the owner who is getting this insemination done in case of the animals. So owner is equally responsible, veterinarian or inseminator is responsible, cow is responsible, and bull is responsible, and straw is responsible. How much is the responsibility? It is not 25%. Please remember, factors are 4. Responsibility is not 25%, responsibility is 100%. 100% for each factor. It is not 90% for anything. It is 100%. Everything must be perfect, then only there will be pregnancy. Cow must be in estrus. Normalcy of post-thaw motility is expected. Detection of estrus must be perfect. And inseminator should proper care for insemination. Then only these factors, they will coincide and we will get the insemination. So this particular part is important. Overt, ovulatory, fertile and fresh type of egg means ovum is expected in case of the animals for conception. This part is very important. Another thing is that our duty is not to go for heat detection. We should not visit any farm for heat detection. Our duty is confirmation. If a owner tells that this animal is in stress, then it is our duty to check whether animal is in stress or not. Confirmation is our duty. Heat detection is the duty, and that is owner's, that is responsibility of the owner. If owner tells that I have observed these type of symptoms, then we have to check it. And even if owner tells that this cow is bellowing, this buffalo is bellowing since night hours, showing ample type of the discharge, we should not believe in this type of symptom. Symptoms are always false. Our rectal examination is only perfect. And our criteria are confirmed one. The next part, next one. Repeat breeding. Animals are repeating. If animal is repeating for 4 or 5 times, buffaloes are put to the slaughter and cows are put in goshalas. This is the burning problem in India. Another important thing is that maximum number of infertility problems are related with the repeat breeding. These are cyclic type of animals. To each 21 days you will find that this cow or buffalo is coming into the stress and once again repeating the cycle. Least care for the cause of the diagnosis. How many causes are related with the repeat breeding? You go on listing and the list will be more than 1,000. More than 1,000 causes for infertility problem of repeat breeding. And buffaloes are put to the slaughter, that is the agony for we all. Next one. This particular part is very, very important, repeat breeding. It is pathological type of condition, whether there is a pathological condition, infertility condition, why conceptions are not there, why it is leading to cyclicity and what type of treatment approach we should have, these things we should discuss. After every estrus, only cows, please remember, only cows, they have mate-estrus type of bleeding. This mate-estrus type of bleeding is seen on day 3rd or day 4th of the estrus after insemination. Mate-estrus bleeding is so common in only strong type of cows, please remember, only strong, healthy and having body score condition better type of animals are having mate-estrus type of bleeding. There is no treatment for mate-estrus bleeding. Mate-estrus bleeding is a physiological phenomenon. Blood occurs, blood comes out. This is the blood which is only because of rupture of small vessels which are lining the endometrium. The bleeding occurs as a withdrawal effect of estrogen. Please remember, this is withdrawal effect of estrogen. In case of human beings, it is withdrawal effect of progesterone, but in case of cows, it is withdrawal effect of the estrogen. This blood takes a day or 2 because it is only a clot, small in quantity. It is always adherent to the tail, base of the tail, and there is no treatment for this. This particular event has nothing to do with pregnancy. Please remember, day 3rd, day 2nd, day 5th, day 6th, these are the days where uterus is not having any type of conceptus. Conceptus is in the fallopian tubes. From 2nd, 3rd, 4th, 5th day, whatever bleeding occurs, that is cleared, and that clearance gives signal for the conceptor that now you come down to the uterus and it is now free for implantation. This particular mate-estrus bleeding should not be confused in case of the cows and no treatment is expected. Owners are always disturbed. And in India, myths are very common. If there is a bleeding, definitely animal will conceive. If there is a bleeding, no, animal will not conceive. Then it is not related with this. So conception is not related with this type of mate-estrus bleeding. Next one. Now repeat breeding. There are a number of causes. If we go on listing, it is the structural type of the lecture for you all. We are not interested in this type of the causes. Next one. We have to categorize this particular repeat breeding into two. But before that, please remember that written records are very less. That is a problem. No observations by the animal owners regarding the estrus. Now, what is expected from the animal owner? Please remember, after parturition, cow is expected to come into the estrus on 60th day, and buffalo is expected to come into the estrus on the 19th day. This first postpartum estrus is totally meant for observations, only for observation. It is not bit for insemination. First postpartum estrus is the estrus for observation. And who should observe? It is the owner should observe. Why he should observe? He should observe it for the duration of the estrus. If I ask to a owner that how much duration is there for standing estrus in case of your cows, he will say that either 2 days or 3 days or 4 days. This is the type of casual approach of the owners. They don't know for how many hours the cow remains into the estrus. A buffalo remains into the estrus. Whether buffalo continues the estrus after morning hours, nobody knows. So this particular answer is to be expected from the animal owner, and therefore the first estrus of 60th day in case of the cows and 19th day in case of buffaloes is for observation of the duration, number one. Number two, discharge. If discharge is crystal clear, thank you very much for the last parturition. If discharge is fetid, if discharge is pussy, if discharge is yellowish, it indicates that whatever postpartum care is taken, that is useless. Something is still remaining inside the uterus, and that needs to be cleaned first, and then only there will be pregnancy. Everybody is in hurry. So once animal comes to the estrus on 60th day, people they go for insemination. In case of cows and buffaloes, first postpartum estrus is not fit for artificial insemination. Underline this particular set. Second estrus. The first is observational estrus. Duration, discharge, and if the discharge is not clear, then we are free for treatment. We can go for the treatment of this animal. We can treat this animal so that in the next 21 days, this animal will be fit for insemination because the discharge for the next estrus will be clear. So that is most important. Balance feeding that we have already discussed. So many things. Next, clinical diagnosis. Simple thing is about the pH. We can go for pH. Observe the pH of the estruval discharge. If it is 7.0, 6.8, 7.2, it is all normal. 7.4 is abnormal, alkaline. 7.6 is abnormal. 6.6, 6.4, 6.2 is also acidic, and that is also abnormal, indicative of infection. Indicative of infection. The second important thing is that about the culture sensitivity test. Send the sample for culture sensitivity. It is not 100% effective, it is not 100% giving us the results, but at least it can give us idea that what type of antibiotics we can use in this particular animal. There are many other tests like Metri-check test, but friends, it is important to note that before insemination, if we observe the discharge and if discharge is showing furning pattern under the microscope, if furning pattern is observable on the under the microscope, 70% conception rate is assured in the world. In the world, I do not know whether we have time to observe it or not, but if furning pattern is observed, if furning pattern is perfect, 70% conception is assured. So for that purpose, furning is very, very important. We have to divide this particular case. Next one, regular estrus and irregular estrus. Now see, regular estrus is 21 days. Irregular estrus, that is something like 22 days, 25 days, 30 days, 35 days, like that. 22 days indicates that in this particular animal, even if there is a death of the conceptus, this is by the day 15 or 16th. But if it is more than 21 days, it is 25 or 30 days, it indicates that there is a death of the conceptus after 21 days, 23 days, 5 to 6 days before the expression of the stress. So this part is very, very important, and this is indicative of early embryonic mortality. If the duration of the stress as irregular stress it is going on, it is chances of early embryonic mortality are more if the cycle length is extended beyond 21 days. The next one. Infectious and non-infectious type of category, we should first assess for for the repeat better animals. Crystal clear type of the discharge is more important. Those animals are only fit for insemination. Turbid discharges are unfit for insemination. pH is a simple test. White side test is so simple that sodium hydroxide is available with all hospitals, or we can make it available. 1% sodium hydroxide solution and the discharge make the equal parts. Boil it on the Burson flame. If there is a precipitation, this precipitate will follow whitish type of the color. All precipitate it will show a white type of the coagulation. White color, no infection. Slight yellow color, mild infection. Yellowish color, turbid color, 100% it is a case of severe type of uterine infection, and such a type of endometritis cases we can check. Those who have attempted for pathology, polymorphonuclear cells you can also observe in this type of discharge. So that is also possible. If the cell number is increased, the case is fit for endometritis. Such a type of cases, those are to be separated. First and the foremost duty is that if the repeat bleeding is the condition, if it is a non-infectious condition, the line of treatment is different. Discharge is crystal clear, furning is proper, pH is normal, and we have to treat this case as a non-infectious repeat bladder. But if it is an infectious repeat bladder, we will have to think n number of things, and this should not lead to any type of disturbances after our treatment. That cyclicity should not disturb. Next one. Next, this is the crystal clear discharge. Crystal clear discharge is a Bisleri discharge. Thickness, viscosity, furning, these are all the conditions. If discharge is clear, then we have to rule out n number of stress types. The first and the foremost one is the short or the prolonged stress. Short stress, in case of Gir cows, expected range is 24 hours. But cow is exhibiting the stress only for 14 hours, 16 hours, this is the short stress. If a Gir cow is unnecessarily showing this stress duration for 36 hours, 42 hours, 48 hours, it is a prolonged type of the stress. Split stress. Cow was in stress in today, exhausted because of the lowered energy level, glucose level was reduced, and now after feeding, after a gap of 12 hours, 14 hours, now cow is having sufficient energy, ready to start ready to exhibit the signs of the stress. Second phase of the stress is going on. Insemination is expected in the second phase only. Please remember, if we have inseminated the Gir cow in the first phase, it is necessary to inseminate that cow in the second phase also. For second insemination, please remember, for second insemination, during the estrus, during the estrual stage, there is a rule. A cow showing signs of the estrus beyond 12 hours of insemination, a cow showing signs of the estrus beyond 12 hours of insemination is fit for second insemination after 24 hours. Please remember, after 24 hours. 4 o'clock evening today, 4 o'clock evening tomorrow, not tomorrow morning at 10 o'clock or 8 o'clock like that. If we have inseminated at 4 o'clock today, if this cow is seen in case of the estrus tomorrow morning, this cow is fit for insemination, but insemination must be after 24 hours of the first insemination. This is the rule. Then next important is the infective type of the estrus. The discharge will be different. One super ovulatory type of the estrus, more number of follicles will be observed, Irregular estrus, we have seen gestational estrus. Please remember, we have to rule out the possibility every time about the gestational estrus. 3.5 months to 4.5 months, that is the only stage. 100 days to 130, 40 days is the stage where animal shows gestational type of the estrus, only in case of crossbred and healthy cows. Our native cows, they will not show such type of gestational estrus unless and until they are very strong and very healthy. By 3rd month, the size of the uterus is beyond pelvic rim, and therefore that should not confuse. This is number 1. In case of gestational estrus, discharge is there, but cervix is closed. Cervix is closed, our first criteria is off. And the 3rd criteria, that is about the ovulation, there will not be any type of ovulation. Let there be follicle. Follicles and the CL, they grow simultaneously n number of times. Even during mid-cycle estrus, one more important thing, mid-cycle estrus. Many veterinarians, they do not know when to inseminate, whether to inseminate on day 1st or whether to inseminate on day 10th, because there is no record at all. If they go on per rectal examination, they will feel follicle on day 1st. They will also feel follicle on day 10th. Both the times discharge is there and owner is ready to pay crores. And therefore, we are inseminating both the times. This is not good. A case is fit for insemination only if there is a follicle on the ovary. A case where there is a CL on opposite side of the ovary, that is the indicative of mid-cycle estrus. CL and GF existence, coexistence on is the day 10th, day 11th of the cycle. It is because of the second wave of follicular growth. And remember, whenever there is a CL, please do not inseminate. Please do not inseminate. If follicle is only, if there are 2 follicles, inseminate. If there is 1 follicle, inseminate. But if there is a 1 CL and 1 follicle developed, please do not inseminate those type of the animals. The next one. Solutions. Number 1 is the AI management. Now let me tell you something about from my experience about insemination. The 3rd phase of the estrus is the fit for insemination. Let it be a prolonged estrus, let it be a short estrus, whatever it may be. 3rd phase, if it is 16 hours, inseminate after 12 hours of initiation of the estrus. If it is 48 hours, inseminate after 32 hours of initiation of the estrus. If it is 3 days, because people, they generally count day 1st, day 2nd and day 3rd, or 3rd morning is also called as day 3rd. 2nd day evening, that is the fit period for artificial insemination. Number 1. Number 2, site of insemination. You can have your own observations with you, but if it is a mid-cervical insemination, it is most appropriate type of insemination. If we inseminate in the mid-cervix, maximum number of sperms are retained into the micelle, bunkers, and slowly those are released toward the ovum. Slowly those are released. Whenever there is a war between Ukraine and Russia, we have seen since last 6 months it is going on. It is not that on one day total Russian military is bombarding on Ukraine. Slowly 1, 2, 3, 4 phases, these type of phases, they will lead to conception. And therefore, sperm should get retained in the micelle, in the bunkers of the cervix. Selective absorption of the sperms is the important function of the cervix, that if it is neglected, then unhealthy sperms, abnormal sperms, dead sperms are not cleared. Cervix will filtrate these sperms. Only healthy motile sperms are allowed to move toward the follicle, and then only there will be conception. So it is very important, the site of insemination. And in case of heifers and in case of cow heifers and the buffalo heifers, inseminate to 3rd estrus. Heifers. In postpartum cases, 2nd estrus, fit for insemination. In case of cow heifers and buffalo heifers, it is the 3rd estrus. Why I am categorizing like this, the 2nd estrus and the 3rd estrus? Please remember that AI is recommended in regular estrus. AI is recommended in regular estrus, and regular estrus is that estrus where we can pinpoint that this particular stress is appeared after 21 days. Animal is in stress, owner is bringing his animal for insemination, we are inseminating it, it has no use, animal will not settle, because we do not know what was the earlier date of the stress. Technology is for regular stress. We are inseminating to stress. Insemination to stress is a wrong thing, it is a wrong concept. Insemination to regular stress is only perfect scientific type of the thing, and therefore, once the heifer they regularize the cyclicity to 21 days, let it be the second, let it be the third, let it be the fourth, that stress is fit for artificial insemination. The next important thing is that in case of non-infectious type of the repeat butter animals, as we have already discussed, we will go for the treatment. Next one, doctor. Yes, GnRH 2.5 ml receptor or gynerich, that will suffice the purpose. Use it along with the artificial insemination. Use it post insemination, day 1 of the insemination. Use it day 2, day 3, day 4. Yes, you can go up to day 5. You are free to use gynerich or the GnRH treatment from day 0 up to day 5th. Because on day 0 it will help for ovulation. Day 1 to day 5 it will help for luteotropic type of the effect. It will stimulate luteinization, or it will form the follicle, ruptured follicle will be luteinized. If this is the treatment line, definitely we will have to change toward the progesterone from day 7th onwards. Very, very important. From 7th, 9th, 11th or 9th, 11th, 13th, likewise you can go for progesterone support, and this is important one. There is a practice to use NSAID on day 12th. This will take care of those type of causes which are unnecessarily leading to secretion of prostaglandins on day 12th, day 13th, day 15th. Any hindrance in case of non-infectious for implantation is taken care of with this NSAID. So you can use it and you will find that crystal clear discharges. Those animals are settled with such a type of line of the treatment. These are the line of treatments in case of non-infectious repeat pattern animals. Next one. One more is the ovusing protocol. If the animal is having crystal clear discharge, start ovusing protocol on any day, but it is more appropriate to go it with diestress. Repeat bidder non-infectious animals can be well treated just like the unstressed animals with this type of protocol. No need to go for any type of observation. Go with this particular protocol and you will get the results. Very simple. Next one. Generally, these type of the things, overo-bursal adhesions and tubal blockages which are leading to infertility problems are very, very rare. Those are very rare. In buffaloes, definitely we can observe such type of cases up to the limit of 3%, 4%. But for that purpose, attempting the PSP test, this is very difficult at field level. Phenol sulfaphthalin test, it is a color solution, pink color solution. We can inject it into the uterus, and after 30 minutes we have to check the urine of that particular animal. If the color of the urine is pink one, patency is normal. If there is a block, the urine will be yellowish. That will be normal. This particular test, regularly it is not carried out, but in case of non-infectious repeat pattern animals, sample straw observation is mandatory. Please remember, it is mandatory. If we are getting 100 straws from the stock, we are free to check 1 or 2 straws and we can write down that yes, I have checked 1 or 2 straws for post-thaw motility. There is no rule that no veterinarian should not check post-thaw motility at his dispensary. On the contrary, if we set a record that yes, out of these number of straws, I have checked and observed, confirmed that this is the post-thaw motility, that will be useful for us. That will be useful for farmer bidders. Let me tell you the case of Boom, our Usmanabad district. when there was a complaint from the owners and the post-thaw motility was 0. So why to do it? When we have straws and when we have right, we are gazetted officers. We can write like this that I have used this particular straw for post-thaw motility. Second important thing is that in case of split stress, I have used 2 straws for inseminating 1 animal on this particular day. Who has prevented? If your diagnosis is split stress, it is a rule that go for second insemination. Go for second insemination. And as per rule, we can very well follow these type of the things. Next one. Non-infectious things. You can add any type of tonics, hematinics, and whatever is available in the market, and which will be very much useful for the animals. Next one. Right. This particular part, non-infection, infertility, that discharge clearance, this is very, very important, and GPG protocol most probably started from 7th day onward. That will give you the results. Next one. Infectious rapid wedding. Very difficult to handle. In India, it is necessary to understand that these are environmental infections. Mastitis and metritis is only because of environmental infection. Subclinical endometritis and subclinical mastitis, these are the best brothers of each other. When there is a subclinical metritis, this will lead to mastitis also. Mastitis will lead to metritis. Environmental infection, and this infection flourishes because 100% Indian farms are wet. WET, wet. Therefore, when I took over the charge of my college, I went to farm, I called a painter and I wrote that Korda Gotha Moza Nota. Marakandey will be remembered afterwards with this particular slogan, Korda Gotha Moza Nota. This is very important. Friends, let me tell you that there is one owner in our state who was worried for mastitis and metritis. 65 crossbreds he is maintaining in Western Maharashtra. What he did, he structured his cow shed in a U form, and he prepared a roof of plastic, transparent plastic, mulching paper. Mulching is a method in case of agricultural crops that to avoid excess of the grass, they use mulching type of paper. Similar manner, whenever there is any barber, he used to put such a type of a thick type of the transparent type of the curtains to avoid the dust and all those things from the road. Similar type of the paper was just made a roof for loafing area, and the problem is reduced to 10%. Reasoning, Korda Gotha necessary. Please avoid this particular fact. And when there are many farms in Bombay and nearby suburbs where ample water is used, that Bihari Bhaiya don't know anything about the animal husbandry practices, but he knows that if he has a pipe of 1 inch with his underpant, everything is wet, and that particular shed remains wet. There is no need for we professionals to understand that infection flourishes when there is water. If there is a dry type of condition, there is no infection. This is the most important thing to avoid endometritis in case of the animals, and therefore this is very important one. Check the discharge. If it is a turbid one, avoid that insemination. Very, very important. Investigate for the antibiotic sensitivity test that will give you some type of the indication that which type of antibiotic is good enough, and also you can go for laboratory investigation. Next one. Environmental infection, you go on listing the bacteria and the list will not end. And the most important thing is in case of mastitis and metritis, Which two friends they will combine and join their hands for infection, we do not know. In one case, first and the second. In the third case, third and fourth. In the third case, it is the second and the third. So many n number of combination permutations are there, and therefore antimicrobial resistance we are observing. We are observing. Next one. This is we should not discuss about fungus and so many other type of the things. N number of things are there. We can go for this type of antibiotic sensitivity test. But please remember that this uterus is incubator. Best environment for Taj Mahal for bacterial organisms, and no one will come out from Taj Mahal. Once there is entry, it is very difficult. It took nearly 10 years to evacuate all militants from Jammu and Kashmir. We do not know how many years veterinarians will take for clearance of all endometriums from the dairy animals. So this is about the uterine environment. Next one, right. In case of buffaloes, do observe this type of small discharge. Next one, non-specific infection, will not discuss much. I will give you this type of the slides to you all, and you can have your reading afterwards. Next one, defense mechanism is most important. No antibiotic will work in case of endometritis and low-grade endometritis. We have to improve uterine defense mechanism. If we go on pouring antibiotics inside the uterus, or if we are using it parenterally, this will not suffice the purpose. And we have used n number of times enrofloxacin, ciprofloxacin, and so many things which are available in the market, but the results are not there. Immunomodulation is a method which is more important, and if you try it, you will get the results. 50 to 60% results are still possible. Please remember, 50 to 60% results are still possible with Lugol's iodine. Lugol's iodine. If we use Lugol's iodine, owner will not be happy. He will say that this is the LSS treatment. But he doesn't understand that this is the best therapy. 60% animals, just 4%, 3% Lugol's iodine, as per the requirement, we can use it. Progesterone will flourish the infection. Next one. This is very important for antibiotics. Broad spectrum antibiotic for aerobic, anaerobic type of organisms. And if we add vitamin E to it, it will also improve the results. Multiple combinations where at least 2 drugs are available. One is the broad spectrum antibiotic, and metronidazole like preparation. If we are combining these two therapies, to some extent we will get 70%, 75% results. Next one. Immunomodulation will be the best type of the therapy. Next one. Friends, there are n number of papers. E. coli polysaccharide. It is not possible to purchase this type of vial from high media for the treatment. 1 gram vial will be costing something like 10,000 rupees. But if there are 10 cases, if there are 15 cases, 20 cases, this particular vial is most useful because this is not antibiotic. E. coli polysaccharide at the rate of 100 micrograms, if the number of cases you are handling in a month, you will be in the benefit. Please use it. This will improve uterine defense mechanism. This will go for influx of the blood, more number of lymphocytes to the site, and infection will be cured. No problem of antibiotic resistance. Autologous plasma is also possible. In some cases you try it. That will also give us the results. And the last thing, please remember that other states, they have started. We are far behind the other states, and that is none other than ozone therapy. Please remember. We have started with this type of therapy in the clinics. Many institutes, they have purchased this. whenever you are proposing any type of material to be purchased annually, recommend for ozone therapy. At least many polyclinics, if they have ozone type of the therapy, surgical cases, medicinal cases and gynecological cases can be best treated with the ozone type of the therapy. Ozone is available, cylinders are available, and you can use it. Best results you will get it in case of the repeat better type of the animals. So our approach must be endogenous, that animal should recover with its own energy. If we are using external type of the antibiotics, it's only wastage, because we do not know and we cannot pinpoint exactly which type of organisms are playing the role in case of repeat bedding, right? Forget about the theoretical things. Both the presentations I will just hand over to Dr. Akole sir, and he will be, or even Reddy sir, he will be able to circulate it to all members. This is my textbook which I published for field veterinarians only. This is available in many libraries. I am not here to promote my book. Please remember that this book is carrying something like 150-200 cases, gynecoclinical cases, which I have observed throughout my life. And every time we have to have a differential type of diagnosis, that particular part I have tried to cover. Next one. This part we should understand. Next. I have to discuss two things as per the directives of Mule Sahab. नाही असं आहे साहेब की धुवायचं नाही, शेण पडणार, लघवी पडणार, युरिन असणार, ते काढून घ्यायचं सगळं. गाय असेल तर ती धुवायला हरकत नाही, धुतल्यानंतर पुसण्याची जबाबदारी आहे, ती कासेसाठी आहे आणि जनावरासाठी आहे. पाणी जर तिथं राहिलं ना साहेब तर तिथं इन्फेक्शन तयार होत राहतं जास्तीत. आणि आपण जी ओपन जे ह्याची लूज हाऊसिंग शेडची संकल्पना केली ना, मुंबईमध्ये हे माझं डेअरिंगच नाही म्हणून मी बोललो नाही लूज हाऊसिंगला. माणसाला लूज फिरायला जागा नाही तर जनावरांना कुठून असणार काय. पण जर लोफिंग एरिया आपल्याला मिळत असेल तर डेफिनेटली दिस पर्टिक्युलर प्रॅक्टिस इज युजफुल सर. Even in foreign countries, they keep the cow sheds dry. Please remember that this is a picture from foreign country.
Sir, I can understand regarding cows.
Yeah.
साधारण स्वतः स्वच्छ राहतात त्या म्हशीपेक्षा. तर म्हशीच्या बाबतीत काय करतात?
म्हशीच्या बाबतीत हेच, म्हशीच्या बाबतीत सुद्धा हेच. आपण काय केलं, जागा कमी दिली म्हशींना, इवन त्यांना रोलिंगला सुद्धा जागा कमी आहे आणि त्याच्यामुळे खूप घाण झालेली दिसते. प्रॉपर जर असेल तर खूप चांगल्या प्रकारे डंग काढून घेता येत राहतो, युरिन काढून घेता येत राहतं. एकदा तरी दिवसातून जर जागा बदलली तर आपल्याला फायदा होत राहतो. धुवायला हरकत नाही, बाहेर जाऊन धुवायला हरकत. दुधाच्या अगोदर जनावरं धुतलं जातं, आय ॲक्सेप्ट, पण पुसलं पाहिजे. जे पाण्याचे ड्रॉप आहेत ना सर, जे पाण्याचे ड्रॉप तेच इन्फेक्शन होतात ना. आणि आपण तरी एन्व्हायरमेंटल इन्फेक्शन म्हणतो. एन्व्हायरमेंटल इन्फेक्शन इज द इन्फेक्शन विच इज प्रिव्हलंट इन द काऊ शेड्स. त्यामुळं आणि रिझल्ट्स आहेत हे जे लोफिंग एरियाचे जे रिझल्ट्स आहेत ना ते एकदम चांगले आहेत. काय प्रश्न. अनेक गोशाळांमध्ये जाऊन मी जवळपास 140 गोशाळांना गेलो सर, राज्यपालांना आपला रिपोर्ट दिला. सगळ्या गोशाळांमध्ये हेच गच्च चिखल, माती आणि घाण सगळी. काही प्रश्न. आणि आपल्याला जे वाटतं ना की धुतल्यानंतर खूप हे होत राहतं, पण आपण सुद्धा रोज आंघोळ करतो, पण तसेच कपडे नाही घालत, पुसल्याशिवाय नाही करत. काही प्रश्न. पुसतो ना आधी पहिल्यांदा अंग. हे पुसण्याची प्रकारच जनावरांमध्ये नसल्यामुळे प्रॉब्लेम्स आहेत. ते जे शीतला राहतं, बुलच्या बाबतीमध्ये शीतमध्ये राहतं, इकडं बाहेरच्या एक्सटर्नल जनायट्याला राहतं, त्याचे प्रॉब्लेम्स आहेत. आणि आपल्याला कन्सेप्शन रेट वाढलेला दिसतो साहेब. ड्राय जर असेल ना गोठा तर आपल्याला लगेच रिझल्ट, इव्हन मस्टायटिसचं प्रमाण कमी होत राहतं. कितीही तशी गरजच नाही सर. आपल्याला मेकॅनायझेशनमध्ये जायचं, आपल्याला मान पॉवर वाढवायची नाहीच. काय प्रश्न नाही. लेट ॲनिमल्स बी इन द लोफिंग एरिया. तिथे सगळे शेण वगैरे जे असेल ते 8 ते 10 तास 12 तास ते तिथं असतील आणि उरलेल्या जागेमध्ये ते बांधून ठेवलेले असते. बांधलेल्या जागेची फक्त क्लिअरन्स करायचं सकाळ संध्याकाळ दुधाच्या अगोदर. काय प्रश्न. शेण नुसतं पडलं तर फार इन्फेक्शन पसरत नाही, पण आपल्याला माहिती की गोठ्यामध्ये छोटाच खड्डा असतो, तो नेमका सड जिथं पसतात तिथं असतो, टीड जिथं होतात तिथं तो खड्डा दिसतो, आणि मग त्या खड्ड्यामधलं जे इन्फेक्शन आहे ते वर्ष. आणि साहेब बरं का, मुंबई पुण्याकडची गोष्ट सोडून द्या, खेडोपाड्यामध्ये माणसं उभा राहू शकत नाहीत असे भयानक प्रकारच्या जमिनी इथं जनावरांच्या. पाठीमागच्या बाजूला एवढा पायातला खड्डा, काय म्हणजे बघवत नाही अशी परिस्थिती आहे. आणि म्हणून मग रिझल्ट बरेच लोक त्याच्यामध्ये म्हणजे डेअरी चांगली नाही म्हणतात की याच्यामध्ये परवडत नाही म्हणतात. हे सगळं परवडणं केवळ स्मूथ, हाय, ड्राय अँड क्लीन, दिस इज द कन्सेप्ट फॉर काऊ शेड्स. जगामधली ही कन्सेप्ट आहे, हाय, ड्राय अँड क्लीन. हाय 3-4 इंचेस हाय फ्रॉम द ग्राउंड लेवल, ड्राय इट इज कम्प्लिटली ड्राय विदाउट एनी टाईप ऑफ वॉटर, आणि क्लीन ज्याला आपण स्टरलायझेशन म्हणतो तर ते. आणि हे सगळं करायचं असेल तर सर सोपी गोष्ट म्हणजे सनलाईट. सनलाईट इज नॉट अवेलेबल इन एनी शेड. वाय नॉट टू यूज अ ट्रान्सपरंट टाईप ऑफ टीन्स, किंवा 2 टीन झाल्यानंतर एक तरी ट्रान्सपरंट शीट टाकायला काय हरकत आहे, म्हणजे सूर्यप्रकाशमध्ये येत राहील. सूर्यप्रकाश न बघितलेले ॲनिमल्स आहेत, मग त्याच्यामुळे थोडेसे प्रॉब्लेम्स आहेत. काय प्रश्न. So this is like this. I think I have given phone also. 2 important things we have to discuss just within 10 minutes. Number 1 is the torsion. We have more number of buffaloes, confinement is more, abdominal size is more in case of buffaloes. There is no attachment for the uterus in case of the buffaloes, and we are regularly observing torsion in case of the buffaloes. Friends, monthly monitoring of a pregnant animal is necessary. This is the number 1. So if we observe it at the stage of 7th month or the 8th month, it is possible that with less degree of torsion, it is possible to restore, rotate the animals to its normalcy. Once the level goes more than 270 degrees, it becomes very difficult, and if the case is long standing, adhesions are formed with the other organs. So even after cesarean section, there are n number of complaints in case of torsion animal. So monitoring is the first and the foremost thing that we should practice. A accidental case which is presented to us, if we are able to palpate it in a proper manner, we have to check stage of the pregnancy, we have to check stage of the degree of the torsion, we have to check the level pre-cervical or the post-cervical. It will involve the vaginal portion also. If we are observing these type of the things, then proper type of the treatment is the rolling with the 3 or 4 rolls with the Schaffer's method. And Schaffer's method is very simple method where a wooden plank is used. It is pressurized from abdominal side and also from the ground side, and then the rolling is to be given. Whenever you are practicing rolling, it is my advice that veterinarian's hand must be inside the vaginal passage, that he should check cervical position continuously, then only he will be able to recognize whether we are performing it in a correct manner. Side of the torsion is the side of rolling. Side of the torsion is side of the rolling, and principle is that in case of rolling, we are making uterus constant and only body we are twisting. So this type of the things are necessary. More than torsion is the prolapse. And in case of buffaloes, which are well-fed buffaloes, which are yielding maximum milk in case of the dairy farms, 2% slope is always given from manger toward the drainage, 2% slope. Full abdomen pressurizes on the uterus. From 7 months onwards, there is a prolapse. Small part of the external genitalia, it will be out, and the owner is always disturbed. Rope thrush is the best method before parturition. Before parturition. Animals which are prone for the prolapse needs rope thrush for at least 7 days after parturition also. So keep it that type of the rope, that will prevent everything. Stitches are most dangerous one. The stitches will also not hold for a long time because they don't have strength like that. Rope thrush is the best method for this type of thing. And simple thing is that stanchion, just reverse the position of the animal so that the tail side will be toward the manger and the head will be toward the drainage. Abdominal load can be reduced by managemental practices only. 5 liters of drinking water at a time, 10 times watering, 20 times watering the buffalo, that is necessary. Feeding of 3 kg, 4 kg, 3 kg, 4 kg fodder at a time throughout the day for 10 times. This is a managemental, but there is no treatment for this. And most important thing is that whenever you are approaching toward the animals which are parturient one, preventive type of approaches are most important. I have a list. I will hand over that list to Reddy and please circulate it. 7th month, drying of the animal. 8th month, extra feeding of nutrients, particularly the minerals. 8.5 months, in case of cows, always go for tetanus. 8.5 months onwards, when 3 weeks are remaining, go for explanta, replanta, parchutone, uterovive, whatever is available as ecbolics. It is a preventive dose for avoiding retention of placenta, and it is most safe. It is most safe if you are using ecbolics before parturition. These are herbal type of the drugs, and they will never go for hastening the parturition process, but they will separate out the placenta from that of the uterus. I have practiced it. I am recommending it since last 15 years. Many veterinarians, they are afraid that if there is happens something, or if the cow delivers 3 or 4, 5 days earlier, unnecessarily owner will ask that this is a drug which is to be used after parturition, why you have used earlier? Not at all. Very safe to use all type of ecbolics which are available in the market. These are herbal ones. 15 days, 20 days before parturition. 1 bottle, 150 ml, 3 days. Followed by good 10 days before actual date of parturition. We do not know whether it will be 10 days or 15 days, but go for feeding of the good. Immediately after parturition, in case of crossbred animals, and if the size of the uterus is very heavy, with 30-35 kg of calf, in case of buffaloes, please remember, collapsing of the uterus is necessary. It is necessary. If you keep that particular animal as it is, it will be difficult. And therefore, even in case of buffaloes, low dose of oxytocin for 3 days, and next 3 days prostaglandins. Collapsing of uterine bag is necessary in those animals where the size of the calf is very, very high. If size is normal, it's okay. Intrauterine therapy, antibiotic therapy for 3 to 4 days, supportive therapy for 3 to 4 days. These are all preventive type of measures, and unless and until those are adopted in every case after parturition, it is not possible for us to have next cycle, healthy cycle after 60 days in case of cows and 90 days in case of buffaloes. So that particular chart which I am following, that will also I will hand over to Dr. Reddy. I think my numbers are with you. Today we could not interact. Please remember that we cannot interact because already it is 6 o'clock and you might have your engagements. But I am available now 24 hours. WhatsApp is available. Both the numbers are available. My WhatsApp numbers are there. You can please ask any type of the thing and I will be happy to be with you. Thank you. Thank you very much.
म्हशींना पाण्याचा फवारा जसं तुम्ही म्हणता त्याच्यात कोरडा गोठा मोजा नव्हता तर ह्या ह्याच्यामध्ये
Foggers is different thing and use of pipe is a different thing. सर फॉगर्स वापरायचे, पाठीवर पडलेला थेंब बेंबीपर्यंत पोहोचत असताना जर शरीरामधल्या उष्णतेमधून त्याचं बाष्पीभवन होत असेल तर आवर पर्पज इज सर्व्ड, हीट इज इव्हॅपोरेटेड आउट, दॅट्स ऑल. थोडीशी जमीन ओली होत राहते, त्याला काही गोष्टी आपल्याला पुन्हा बदलता येत राहतात, काही ओले पडदे लावता येत राहतात, वरती छताला पांढरा रंग लावता येतो, हे लावता येत राहतात, वरती पेंड्या टाकता येतात, असं काही करता येत राहतं. म्हणजे अल्टरनेटिव्ह प्लीज. लोखंड, दगड आणि कॉन्क्रीट हे असणारे गोठे फायद्यात ठरत नाहीत. धुम्मस केलेला असावा. हरियाणामध्ये ते ब्रिक्स आहेत ना, तर ते अशा उभ्या लावलेल्या असतात, ते पॅक असतात सगळं. कॉन्क्रीट म्हणलं की तापणार, तापलं म्हणलं की ते गरम होणार, गरम झालं की ते युटरसला आपला अडरला त्रास द्या. आणि सगळ्यात सेन्सिटिव्ह ऑर्गन तर आडर आहे. क्रॉसबेड कावला तर जमतच नाही. आणि म्हशीच्या बाबतीमध्ये सुद्धा सेन्सिटिव्हिटी जास्त असल्यामुळे उन्हाळ्यामध्ये जिथं गरम होत राहतं, टेम्परेचर हे 40, 42, 45पर्यंत जातं, तिथं कधीही टेम्परेचर खालचं वाढू नये या दृष्टीनं कॉन्क्रीट, लोखंड आणि दगड सोडून ब्रिक्स चालतील. अगदी पुन्हा पुन्हा धुम्मस करून घेणं गरजेचं आहे.